I am Professor Dr. Arindam Sarkar, plastic and cosmetic surgeon. Today we will discuss regarding the breast augmentation, that means enlargement of the breast. Now, why the enlargement is required? Sometimes due to the excessive diet, or to nowadays everybody is controlling diet very much, so we get in very lean and thin patients, but the problem is that the breast doesn't develop. So they have a tremendous psychological problem using only padded bra. Again, that gives some psychological problem. So they usually come for enlargement of the breast. Now the question is, sir, how do you achieve it? Now you see there may be two options. The easiest and commonest, which we are doing over last 20 years or more, is the putting a silicone implant. There is another problem, or if they don't want a silicone implant, we can give fat injection also, but fat has to be available. Now let us discuss for the silicone implant first, which is the commonest all over the world. There is a taboo that this silicone implant causes a lot of things, a lot of side effects, but that is not true at all. In any surgery, there may be some side effect like infection or anything. These are extremely rare because adequate precautions are taken so that there is no infection. There is a rumor that whether it may be associated with cancer or some rupture. Again, the answer is that if it is done at a good place, at a good quality of FDA approved implant, then these complications should not happen. So any implant used must be a USA FDA approved implant, so that you don't get any implant related complication. Now the other problem is that how big you want. Now again, it depends on the two things. Firstly on the chest size. We measure the chest size, we measure the width of the breast, then we tally in a chart is these two things, so that the implant is either it is not too big or not too small. That is number one. Another point is that in a very lean and thin patient, we do not want to give a very big implant, because the implant has to be carried by the lady. So it is very heavy or the skin cover is very thin, then it might give some problem. So implant should be selected as per choice of the patient, obviously, according to the body weight, body mass, and also according to the profession. Say somebody, mostly those who come to us, they're either in the show business or doing some serial or working in some desk like front desk like hotel or other services, in whom the appearance is extremely important. So they need a type of the implant slightly bigger and more fullness they want, especially in the upper part or upper central part of the breast. But there is another very group, those who are in the teaching or normal profession or housewife. They don't want a very big implant, because in their profession, if they go by it, then it becomes sometimes problematic. Normally we prefer a moderate size of implant. Usually the implant we give is a two types or two sizes. One is a rounded implant, one is called teardrop or breast size implant or breast shape implant. Now the rounded implant is common because the problem is less. It becomes completely natural, and if it rotates, it again round. But the teardrop or breast size implant, the problem is that if it is not properly placed, then it might look odd. So normally I don't use this teardrop implant. Normally I use silicone implant, which is rounded and of medial profile. Medium profile means the texture, it may be soft, it may be medium, or it may be slightly more hard. Now those who want more prominent, they might sometimes prefer a hard implant or high profile implant, we call it. There if you press it, the frill is slightly harder, and in a moderate implant it is completely natural. And in soft implant, if somebody prefers slightly soft feel of the breast, that can be given. But essentially all these three are same. And before this type of surgery, we measure the size of the breast, as I have told. We measure the size of the chest. Then we select the implant. As a preoperative preparation, we give 2 days antibiotic, cleaning the body with betadine solution. Then we put the patient under anesthesia. So this is the whole preparation what we use. If somebody smokes, we usually ask to stop smoking. This is done for two reasons. One, in smokers the skin problem may be there, and the second is that sometimes the anesthetic problem comes. So the smoke should be quitted for few days before any surgery, not only the breast implant. And after surgery, It is very simple. Normally, we discharge on the same day. We advise the patient to take admission 8 in the morning. We discharge within 4 to 5 in the afternoon. You can go the same day. And after that, after 2 days, the regarding the post-operative management, it is very simple. You just change the dressing after 2 days. You start taking bath, do a small dressing or a sports bra. Then you can go to your office or college or in your profession, whatever you want. Only thing is that heavy hand movement like gym or swimming, these types of activities should be restricted around 6 weeks of time. Regarding another postoperative management advice is that we give some antibiotics and painkillers for first 7 days, and any handling of the breast or pressing of the breast is advised to avoid for around 6 weeks of time. But after 2 weeks, you should start a breast exercise, that is pressing from the above, pressing from the below, pressing from the medial side and pressing it from the lateral side, so that the implant nicely moves within the breast tissue. It is to be continued for a few months up to 1 year, so that the breast implant is kept rotated and soft. This is a good advice which should be followed by any candidate who has undergone breast implant surgery. So another message is that sometimes people come say us, I have done an implant 10 years back. Now few people come for a removal. Why? Mostly the reason is that time it was essential. Now they feel that it is not essential. So doctor, you either remove it or you please change it. I mean, so whenever we change, we give a bigger size of implant. That is also possible. That is also simply because now you are already a formed sac. So you just remove the implant from below, then replace it with a larger size of implant. The rest of the procedure is very much same. So we request you to come to our clinic for further advice. I have given you as much as possible. Now for the rest of the advice, you please come have a consultation. Get to know that what are the things, how it happens, what may be the other things you must know. Thank you. And also share our video if you like it.